Hi everybody. So, what is pain in the body? Pain is an unpleasant sensation and emotional experience that links to tissue damage. It allows the body to react and prevent further tissue damage. People feel pain when a signal travels through nerve fibers to the brain for interpretation. There are five most common types of pain: acute pain, chronic pain, neuropathic pain, nociceptive pain, and radicular pain. So, what are pain inhibitors? Basically, cyclooxygenase 2, that is COX2 inhibitors, are a type of non-steroidal anti-inflammatory drug, NSAID, that specifically blocks COX2 enzymes. Non-steroidal anti-inflammatory agents, usually abbreviated to NSAIDs, are a group of medicines that relieves pain and fever and reduce inflammation. What is the difference between COX1 inhibitor and COX2 inhibitors? In the gastrointestinal tract, COX1 maintains the normal lining of the stomach and intestines, protecting the stomach from the digestive juices. The enzyme is also involved in kidney and platelet function. COX2, on the other hand, is primarily found at the sites of inflammation. So, which NSAIDs, that is non-steroidal anti-inflammatory drugs, are COX1 inhibitors? Among the traditional NSAIDs, other than aspirin and indomethacin, only few examples of selective COX1 inhibitors: SC560, 560, FR1 22047, Mofizolac, P6, and TFAP have been so far identified. The review has a scope to stimulate the development of novel drugs, which has the activity is COX1 mediated. There are nearly 24 different NSAIDs available, but they all work in the same way, and that is by blocking a specific group of enzymes called cyclooxygenase enzymes, often abbreviated as COX enzymes. What are the different types of non-steroidal inflammatory drugs available in the molecules? Ibuprofen, naproxen, diclofenac, both sodium and potassium, celecoxib, mefenamic acid, etricoxib, valdecoxib, rofecoxib, indomethacin. High dose aspirin, that is low dose aspirin, is not normally considered to be an NSAID, that is non-steroidal anti-inflammatory drug. The main mechanism of action, that is MOA, of non-steroidal anti-inflammatory drugs is the inhibition of the enzyme cyclooxygenase, COX. Cyclooxygenase is required to convert arachidonic acid into thromboxanes, prostaglandins, and prostacyclins. The therapeutic effect of non-steroidal anti-inflammatory drugs are attributed to the lack of three eicosanoids. How does NSAIDs, that is non-steroidal anti-inflammatory drugs, works in the body? NSAIDs block a specific enzyme called cyclooxygenase, or COX, used by the body to make prostaglandins. By reducing production of prostaglandins, NSAIDs help relieve the discomfort of fever and reduce inflammation and the associated pain. So, what is pharmacodynamics of NSAIDs, that is non-steroidal anti-inflammatory drugs? The therapeutic effects of non-steroidal anti-inflammatory drugs are mediated chiefly through the inhibition of prostaglandin synthesis. Prostanoids are formed enzymatically through prostaglandin and endoperoxide synthesis, and PGHS1 and PGHS2, which are also known as cyclooxygenases 1 and 2, that is COX1 and COX2. What are the three properties of NSAIDs? Analgesic, pain-killing properties, anti-inflammatory properties, antipyretic, that is fever-reducing properties. Which NSAIDs is irreversible, that is non-steroidal anti-inflammatory drugs. For example, if you take aspirin actually it will work as a NSAID also. It is good for myocardial infarction because aspirin is the only NSAID, that is non-steroidal anti-inflammatory drugs, able to irreversibly inhibit COX1 inhibitor. Is also indicated for antithrombosis through inhibition of platelet aggregation. This is useful for the management of arterial thrombosis and prevention of cardiovascular events like myocardial infarction, in a layman language, heart attack. So whenever you feel pain, when you get pain, don't ever and ever go to a retail shop and perform medicines. Immediately you rush to a qualified doctor, whether it is acute pain or chronic pain. A qualified doctors can give you a solution wonderfully. Thank you very much.